Hello everyone. Once again, the health insurance marketplace is getting underway and getting ready to start open enrollment for 2016. And of course, they've made it complicated as usual. So I just want to share a little bit of information and insight with you. My name is Carlos with American Insurance Brokers, and you're more than welcome to check out my site. It's www.aibins.net. Very simple to use, user-friendly, not a bunch of frills and whistles. It gets right to the point. You can come right to my website, and you can look at health insurance quotes. If you're still on Medicare, Medicare Supplement, Medicare Advantage, life insurance, disability, as well as other benefits that I'll be featuring on my website. But this makes things a lot simpler for you. I'm licensed in 26 states, so I'm more than able to help the majority of you out there. It's a proven fact that over 3 million individuals had the wrong plans on the exchange last year, which translates into billions of dollars that were lost on deductibles, co-insurances, and out-of-pocket maximums, simply because they didn't have the proper guidance on selecting a plan on the exchange. I can help you do all of this, and it won't cost you a dime out of your pocket. I don't charge you any more money to use my services and help you than if you were to go do it by yourself. So why not use somebody with 22 years of experience? This is kind of what you have to look forward to. If you go to healthcare.gov to do your enrollments, you can preview 2016 plans. I'm just going to type in my local zip code here to keep things simple. It's going to have you choose the county. And this stuff is easy initially. Actually, let me go back for a second, because number one, if you say that you have a health plan, you're going to have to enter your plan ID number. Otherwise, it gets a little sticky, or it gets hard to continue. Yeah, I guess you can skip it, but still, just more information. I'm just going to put just myself to continue. You have to go through all this free enrollment form and all this information, and then in the end, it gets kind of sticky. Now, this is extremely important for folks who have families and you hit a certain cutoff, and this is what I mean. So let's say, for example, that yes, you are married and you are going to have dependents to claim on your taxes. Let's say you have a household of 3. We're going to enter myself, male. I'm going to say that I'm not eligible for any other insurance. Wife. All right, same thing. Going to go ahead and enter your child. So we'll go with a 17-year-old. We'll go with a 15-year-old. And we'll go with the 13-year-old. No offense, ladies, just the guy's button's easier to hit. So here we have a family household of 5. Okay, I'm going to go ahead and continue. And we're going to say that my gross income for the year, if I'm W-2, you're going to go by your pre-taxed money. Everybody who's working in that household. Okay, so if working in the household, expected household income, let's say, is going to be $55,000. Okay, if you're self-employed, then it's going to go by your adjusted gross income. So that's after all your expenses and write-offs and everything. So I'm self-employed, so let's just say, for example, my write-offs were $55,000. After deductions was $55,000. Now here's where the problem begins. Because the system automatically flags that your children are going to be eligible for Medicaid. Okay? But I can assure you, and I can promise you, that my children are not eligible for Medicaid, because of when it comes down to our assets and business and things that we have to do the business. I mean, there's no way in heck. In fact, the majority of individuals out there are not going to qualify for health insurance or for Medicaid. So already you're kind of stuck in a situation here to where, what are you going to do? You can't get proper and accurate quotes. So it says down here, most folks are going to kind of bypass this, and they're going to see this $248 a month. They're going to think, I'm only getting $248 a month for my whole family. Okay. But the problem is, see, you just got to go through all this stuff. Okay. Then you got to try and figure out all these plans by yourself. And if you're looking for the cheapest plans and you happen to choose this plan, well, it's a horrible plan because the network is ridiculous and there's not very many people that you can go to unless you drive quite a bit. Okay, so understanding the network is pretty important and what most people don't get or understand. So let's say, for example, we're just going to go off this plan. So it's going to say right here that this is only quoting me for I'll go up here to my estimates right here. So spouse, 3 other dependents with estimated tax credits. But what it's saying is the 3 children were supposedly qualified for Medicare. So this is really only quoting myself, my wife, and I think the 17-year-old. So I think it is the 3 kids for Medicare. So once again, this isn't giving the proper credits on the plans that you're looking for. Okay, so if I click on this plan right here, okay, although it says that the children's here are included, it's assuming that they're going to be eligible for Medicaid, so therefore it's not really including them on the quote. So you're going to get a lot of false quoting, and then when you go and do the application, it's going to automatically throw the kids in the Medicaid. You're going to have to wait on that application. By the time you get anything done, it's already going to be February or March of next year before you get the proper information, and then you have to go and put the kids back on your plan. And then now they've been 3 months without coverage. So it gets pretty ridiculous and pretty hairy, and there's no reason that you should have to do that. I'm a qualified agent, 22 years of experience, and I can help do all of this stuff for you. You don't have to do it, and you don't have to pay any more extra than if you went and did this yourself. So instead of having to deal with all this, it's much nicer if you go to my website and you at least get the process started. Okay, you click on that. You want an ACA quote, which means you think you're going to go ahead and qualify for tax credits. Oops. I apologize. It's supposed to, I updated everything recently. I got to do a refresh. There we go. So now we should have the proper link. So now it's going to take you to this nice looking website here. You can put in your information. Joe Smo. Say joe@nomail.com. Okay. Type in some simple, quick, fast information. And I'm just going to keep it simple. I'm just going to put one individual for now, myself. And then boom, you're already right into the quoting. So we bypassed having to go through all those questions and all those different things. And you can do this yourself just to kind of look at the plans, get the pricing. But ultimately, you're definitely going to want to give me a call to go through these plans and help explain everything in detail, but most important, understand the networks. Okay, and then we can go ahead and complete the application. When you go through me, when you go through the healthcare.gov by yourself, it's going to take you anywhere from a half hour to an hour, sometimes days if you run into glitches trying to get set up in their system. If you go through me, I'll have you done and out the door within 10 minutes, and that's including doing the application process. So I can make life a lot easier for you and help you find the plan to fit your needs and your budget just by simply helping you shop smart. So give me a call. Again, my name is Carlos with American Insurance Brokers, Insurance Made Simple, and you can simply reach me by calling at 574-936-4152, 574-936-4152, or visit us on the net here at www.aibins.net. Have a great day, and to your health.